Everybody. Thank you for joining us today. We'll just give it a few more seconds for people to join and then get started. While you are joining, please help fill out the poll that's on your screen just to help us know a bit more about you and about how you heard about the webinar and how you heard about our programs. Okay, I think we can get started now. Again, good morning, good afternoon, good evening, everyone, depending on where you're joining us from. Thank you so much for taking out the time to join this webinar today and for your interest in our LLM programs and just generally our work here at the O'Neill Institute. If I haven't met you yet, my name is Olo Igbohare. I am the Assistant Director of Health Law Programs and Capacity Building at the O'Neill Institute at Georgetown Law. And basically, I manage the LLM programs that we have here at Georgetown Law. We've done a series of webinars prior to this, just introducing our programs, letting you know about the application process. We've had current students share about their experience as well as past students. And so if you have any questions at any point in the webinar about the application process, please feel free to drop it in the chat. I'll also drop my email address in the chat just so that you can have access to that. And we will reach out to you with responses. But today we're focusing basically on what health law is. We know that sometimes people come to this program with interest in the field after having personal experiences with health challenges and just want to know how they as lawyers can work in the field or use their legal skills and apply them to public and global health. And today I am gratefully joined by a panel of esteemed colleagues here at the O'Neill Institute who are doing the exact work that many of you have expressed an interest to do. And the basic goal of this webinar is just to share about their work, share about their experience. Some of them are past students of the program, of the LLM program. We also have a former Georgetown JD as well, who is on the call. So they will share about their experiences working at the institutes, their experiences as students, and their experiences generally working in health law. And so feel free at any time during the webinar to drop your questions in the Q&A box. We'll get to them at the end. At this point, I want to hand over to the panelists just to introduce themselves, tell us a bit about yourself, where you are from, and what you do. I will start with Sonia and just going in the order in which I see you all on my screen.
Hi, hello everyone. Thanks for joining us again. I am Sonia Kenzader. I am the Associate Director for the Institute's Center for HIV and Infectious Disease Policy. I have been at the Institute for about 10 years. I have both my JD and my Master in Public Health, and my work focuses primarily on infectious disease policy domestically, so strictly U.S. policy.
Thank you, Sonia. Over to you, Jennifer.
Hi, everyone. My name is Jennifer Martinez. I'm a legal fellow in the Center on Addiction and Public Policy. I received my JD in December of 2023, but prior to that, I earned a PhD in immunology. I'm currently working on policies and regulations surrounding substance use disorder and the overdose crisis. For an example, medications for the use of opioid use disorder.
Thanks, Jennifer. Agrata?
Hi everyone, I'm Agrita. I'm a 2022 alumni of the Global Health LL.M program, and I'm a physician and a lawyer from India. Currently, I'm working as an associate with Center for Global Health Policy and Politics. So this center basically lives within the O'Neill Institute and Georgetown School of Law, and so that's what I'm doing right now.
Thanks, Agrata. I'll pass it on to Kashish.
Thanks, Solo. Hi, everyone. Good morning, good afternoon, good evening. I am Kashish Aneja, mostly based out of Delhi, but right now I'm in Boston. I've been a consultant with the O'Neill Institute with the Center for Transformation Health Law, and I'm completing my 5 years this summer. A lot of my work is around global health security, pandemic preparedness and response, and commercial determinants of health. I'm also a visiting scholar at the Harvard Law School this spring.
Thank you, Kashish. I'll go to Isosa and then Oscar.
Hi, good morning, everyone. My name is Isosa Osagai, and I am an associate at O'Neill on the Center for Health Policy and the Law. I started out initially working with Sonia a bit at the Center for HIV and Infectious Disease Policy, but currently working for the Center for Health Policy and the Law. And what we kind of do is monitor trends in litigation that might affect healthcare in any way. We particularly focus on cases affecting health equity, access to healthcare, and healthcare affordability. We also run a litigation tracker that allows people to keep up to date with filings or just important updates on these kinds of cases. We mostly write, but sometimes do speaking engagements on what we find in these trends and how they're affecting healthcare. Occasionally we work with partners like researchers or maybe advocacy groups, things like that, on just trying to understand the implications of lawsuits or policies that might pop up. Some of the stuff we're working on right now, just to give a couple examples, are we're looking at drug affordability initiatives that are being proposed by different states and some of the lawsuits that are being brought against those and what they mean, as well as lawsuits that are being brought against equity initiatives and what those mean for healthcare and health equity.
Thanks, Isosa. Oscar.
Thank you, Lulu. Morning, everyone. It's great to be here. Thank you for the invitation. My name is, morning, afternoon, evening. I forgot that we have different time zones. My name is Oscar Cabrera. I've been with the O'Neill Institute for 18 years or so now. So it's been a long time. Have different roles at O'Neill. Right now, I'm the director for the co-director for the Center for Health and Human Rights within the O'Neill Institute. I'm also a visiting professor at the law school where I teach a couple of courses. And at the center, what we do, it's one of the centers within the O'Neill Institute, and we focus at that intersection between health and human rights. We work on different topics and different ways. We work on capacity building, strengthening. We have partnership with different universities. We work in different countries at the national level. The way I will divide our work is in 4 buckets of work. We do work on corporate actors and their impact on health, and that's our work on tobacco, food, and alcohol, with that framing of corporations and the impact that they have on health. We also have a big area of reproductive rights. We collaborate a little bit in the US, but mainly in Latin America and in some countries in Africa, where we support partner organizations to kind of implement, expand access to reproductive health services. We had an area that is somewhat new. A couple of years ago, we launched this, which is on litigation standard setting. We engaged with both the UN system, regional systems, on trying to support technically committees, experts, different regional and systems and actors from the universal system, support them with technical assistance on health-related issues. An example of that, we support drafting of general comments. We support drafting of reports by the UN Special Rapporteur of the Right to Health. But we also have been taking on direct representation of cases. So we have cases we're litigating both at the UN level and also at the intra-American system level. And we have a new area which we're calling our innovation lab, and where we're folding a lot of new projects, ideas, smaller projects that we're trying to launch, like issues around end of life, climate change and health, immigration and health. So those are smaller projects that we're trying to incubate in that area and then hopefully launch into larger set of initiatives within the center. I'll stop there, Olo, and over to you. And it's great to be in this panel with all of our colleagues from O'Neill and people that I haven't seen in a long time. And I'm looking at Kashish that I haven't seen in a long time, but it's great seeing you, everyone here.
Thanks, Oscar, and thank you to Oscar and Isosa for kicking us off on the next question, which was basically to introduce your center. So just for people joining us, our work at the O'Neill Institute is divided across centers and topics. So everybody on this call is from a different center at the Institute. And even though some of the work of the centers overlap, a number of them focus either on global work or on US national work. And I'll let the members of the teams introduce better their work at the centers. But just wanted to ask if you can give us a brief overview of your work and the work of your center, and also the focus that you have, whether it's national or global or even state level. And for that, I will start with Kashish.
Thanks, Solo. I didn't expect I'd be the first one. Okay. So as I mentioned earlier, I'm at the Center for Transformation Health Law. Our center was formed right at the cusp of the COVID-19 pandemic, somewhere in the summer of 2020. And as the name suggests, it's the idea for the center is to transform the way we look at health law and in a sense, apply the learnings and the lessons which we have learned from the COVID-19 pandemic across different streams in health law, and to rethink, for example, how do we respond to pandemics? How do we respond to commercial determinants of health or different NCD risk factors based on the lessons which we have learned in the past 3 years? How have different countries responded to that? And in that sense, we've done a bunch of work over the past 5 years, including supporting the WHO and the Intergovernmental Negotiating Body on the WHO pandemic treaty negotiations. We have worked extensively on commercial determinants of health in the Southeast Asian region. We have worked on universal health coverage in the Africa region. We have worked on some reproductive rights work, which Olu has led for us in parts of Africa. And that's just to give you a broad idea of different work streams that we have.
Thank you, Kashish. Agrata?
So if I had to kind of break down like GHPP's work, I think we work at the intersection of global health law and political science. And we're a multidisciplinary team, basically consisting of like epidemiologists and microbiologists, political scientists, lawyers, and so on. And like, if I had to break it down to the simplest terms, I think we work more on terms of like, access to better commodities, better services for especially HIV and TB on a global level, and like how do we bridge those inequities that exist currently. So I usually see it like, if I had to kind of understand this work that they do, I break it down in terms of like this one thing that one of my sort of mentors said that, poor people get poor health systems, but how do we break that cycle? So I think GHPP works on that front in a very interesting way. So basically what we do is we conduct like research and policy analyses and then partner with in-country civil society groups on one hand to basically spur demand for better health commodities and services. And on the other hand, we aim to engage with like national, regional, and global actors to advance like, optimal health policies at the national level. And then there's obviously, a thread of like accountability through and through. And just to break it down, like, what are the focus areas that we work on? So we work on obviously HIV. If you all haven't seen HIV Policy Lab, I would really encourage you to see it. It's something that Kashish worked really hard to build, and now it's excellent. And then we're doing something similar for TB too now, so that's super interesting. And then we're also developing like projects that are more cross-cutting in nature, like diagnostics and monoclonal antibodies, and how do we ensure that there's greater access to these products. And then one of the interesting things is that GHPP is a designated UNAIDS collaborating center. So on that front, we work more on like how do we bridge these inequalities during pandemics and all of those things. So we're developing something known as like an inequality index. So that's super interesting again. So I think that those are like the broad strokes of like what GHPB does. Thank you.
Thank you, Agatha. I'll pass it on to Jennifer.
Hi, everyone. So I work in the Center on Addiction and Public Policy, and we work with a variety of stakeholders like physicians, government officials, advocates, researchers, and people with lived experience to advance an evidence-based and public health approach to addiction and recovery. We work at the national level. Our director regularly informs Congress about public health-based policies for substance use disorder, but we also work with state and local level leaders as well to tailor responses to their unique needs for their addiction crisis. And our goal is to distill this research into actionable steps to address addiction, increase equitable access to care, and support recovery. And part of our focus is on high-risk populations, such as those in carceral settings, and leveraging rights through the American Disabilities Act to receive appropriate care for addiction while they're incarcerated. We're also enthusiastic about capacity building. We have Addiction and Policy Scholars Program, as well as a master's program in addiction and public policy to build the leaders in this space of the next generation. And infused throughout all of our work is the importance of the voices of people with lived experience who should be at the table when policymakers are making these decisions.
Thank you, Jennifer. And then Sonia.
Hello again. So as I said, I am the Associate Director of the Center for HIV and Infectious Disease Policy here at the Institute. And our work is focused on improving access to treatment and care options for people living with HIV in different subpopulations in different demographic areas who are facing different socioeconomic challenges. And we are wholly focused on US-based policy. And we also work on issues related to other sexually transmitted infections, as well as other infectious diseases such as hepatitis, viral hepatitis, hepatitis C, hepatitis A and B as well. And because there is a lot of intersection with viral hepatitis, HIV, and even substance use and substance use disorder. And so the Addiction and Public Policy team is one that we probably do the most collaboration with here within the Institute because of the many intersecting factors across our work. And the style of work that the Center for HIV and Infectious Disease Policy does is that we were really focused on bringing together different thought leaders and different, sorry. I'm sorry, that's just gonna have to ring. We bring together different thought leaders and different stakeholders across people with, I'm so sorry. I am so sorry. I'm at my mom's house and she still has the house phone, so I apologize. Sorry. So yeah, so we bring together different thought leaders across the space and hold convenings where we provide a forum for people with living experience, people who are the actual recipients or the people who are the most affected by the issues that we're looking to study, to the table with policymakers, with government officials, with other people from across the country, and we kind of bring them all into one room so that we can all share information, share knowledge and experience, and use that converging of knowledge to inform our policy recommendations and the information that we take back and bring forward to policy leaders to advance many of the recommendations that we bring forth related to improving healthcare and access for people living with HIV or people at higher risk for acquiring HIV. Some of the most recent work that we have done is really putting forward more information to improve healthcare access for gender nonconforming people, transgendered persons, as well as improving access to longer acting preventative HIV treatment or HIV preventions, as well as long acting HIV treatment, and how we can improve access to those as well. So that's kind of the primary focus of the work that we do.
Thanks, Sonia. I'll pass it off to Isosa.
Thank you, Olo. I just wanted to add a little bit to what I said earlier. So as I mentioned, I work for the Center for Health Policy and the Law, and I didn't mention that that is one of the US focused teams. And so in addition to what I said, we kind of there are cases happening all the time across the country, and what we do is kind of identify, like, here's a case that might have important implications for like national healthcare policy. And then in addition to that, we get questions from media, so if someone is going to be writing a story on, say, a Supreme Court case or just some case that popped up, they'll kind of contact our team and say, what does this mean for healthcare? So we provide that kind of like legal analysis, translating that into things that people can understand, and just making that stuff more clear. So just wanted to add that.
Thank you, Isosa. Oscar, I know that you had earlier also introduced your team briefly, but I wanted to see if you had anything else to add about your work.
Thank you, Olo. I think Isosa and I just jumped the gun on that question. I was just following the discussions. No, the only thing that I would add is sometimes it's hard to explain like the breadth of the work we do at O'Neill, and then we're trying to give you some sampling of the projects. But if we start unpacking, I mean, what Sonia just said about engaging experts and how those experts we work with them to help inform best way to build like policy, and then we turn that into report. That's a methodology of work that different centers within the institute use for their areas. So what I would say is like the basic, the way I explain this in like a minute or so is, we work at the same level on capacity strengthening, and that's through formal mechanisms, through LL.Ms, through master's programs, we engage with universities, but we also try to strengthen the capacity of like actors that are doing the applied work, right? So we have partnership with governments to train government officials, with the judiciary, with civil society organizations to build sort of training and strengthening capacity in that space. The second piece for us is scholarship, and that's important, right? I mean, rigorous research and analysis, because although we go to the real world to try to affect change, I mean, that's the premise of the institute. It's not just to be isolated an academic institution, but to build this scholarship work to then have an impact on the real world. So we do advocacy, but with that high level of like research and rigorous research, right? So this is not just advocacy for the sake of advocacy. It's that we do the research and then we go to the third leg of the work, which is more the technical assistance support. We roll up our sleeves, we work with governments, sometimes with side by side, sometimes on opposite sides when governments need to kind of be brought to the table through engaging with the judiciary. We work with civil society organizations, international, intergovernmental organizations. And in all of that, we have different ways in how we engage either students, prospective students, and I know, although I might be jumping into some of the other questions that might come later, but what we do is we build teams, and we build teams within our institute and within our centers. For example, the Center for Health and Human Rights work close to 20 people, a little bit over 20 people, and we work at all these levels, right? There's some staff that are more engaged with capacity strengthening, some with the applied work. And the last piece that I will talk is about geographies, right? I mean, we have program representation here from programs that are more US based. Some of the programs are more global, like what Kashish and Agrada were just talking, is more global in nature. Our Center for Health and Human Rights focuses a lot on Latin America. We have a big presence in Latin America and the Caribbean, but we also have presence in Africa. We have projects in South Africa, Uganda, Kenya, a small project that we're kind of trying to expand in Senegal. and I saw that some of our colleagues from the region were connected. So I saw Philip and some of the colleagues that I've known for our work in South Africa. We're also working in Asia right now. We have projects in Indonesia. We have working certainly smaller projects in Korea and China. So the idea is like to also have that impact outside, following the three sort of lines of work. I'll stop there because I think I went over my time. So over to you.
Thank you, Oscar. No, that is very helpful. And I like what you said about just giving people a taste. And that really is what this webinar is supposed to do. Just give you a brief glimpse into the work of the Institute, the different areas that you can get plugged in if you come in as a student, and the different ways to engage, which we'll go into next. Just to also encourage you to just continue putting your questions in the chat. I can see that we have a couple already. We'll take the questions at the end. But just as Oscar started to address this, I wanted to find out from our panelists, what are the ways that your center has engaged students in the past? And have you worked with RAs, interns, or fellows? And if you have, what has been the most rewarding part of that experience? Just to give people a brief background, one of the I would say one of the best parts of doing an LLM here at Georgetown in health law is the fact that students get to engage with experts at the O'Neill Institute. You get to work as a research assistant, and sometimes we have people come in as fellows at the end. But every year we also take summer interns from across the world to work here for 8 weeks during the summer and to get to support all this amazing work that you have heard. So I just want our panelists to share a bit about the different ways, that they have engaged students in the past and what the most rewarding part of that experience has been. Since Oscar kicked us off, I will start with you, Oscar.
Thank you, Olo. Following Kashish's previous comment, I was not expecting to go first. I mean, there are definitely like different ways in which we engage students. And if you look at most of our teams, right? I mean, we have representation here. I mean, Kashish was one of our students many, many, many years ago. So I think that's the idea, right? I mean, how we can then try to incorporate our students while they're doing the LLM. Of course, there's research assistant opportunities. They do engage in the research. They do, and it's not necessarily like more like traditional university research assistant positions in which people might be doing research for a faculty member's paper. This is actually research already on the applied work. Right? So students get, the way at least we do it in our centers, they get embedded into the work we're doing and how they can really roll up their sleeves and start working. It can be like a steep learning curve because sometimes we just kind of want them to be engaged directly with the partners and with the projects. Then our center relies heavily on also fellowship opportunities. That's how we actually get to engage with our graduates and with like recent grads and fellows, recent grads from other programs that want to come in and work with us. We do, of course, prioritize students from our program, not just because it's our program and we're very proud of it, but also because they go through already the training that are the basis for our work, right? So they take the core courses, and when they come and they join the teams, then they have already that base set of knowledge. So fellowships are key for us. So I mentioned research opportunities like fellowships, and then I'll stop there. There are other ways in which we have engaged with prospective students through internships. Maybe Olo, you can explain that. And I think the idea is just to incorporate directly into our work. It's our former deputy director years ago used to use this expression, baptism by fire, which is like you just get and start doing the work, and we all learn by doing, which is great about this field, right? The global health law. It's an established field, but we're not talking about contracts, right? We don't have 3,000 years of like doctrinal sort of development. So the field is constantly evolving. And of course, what's happening right now in the world with administrations taking positions that might be contrary to try to preserve global health or improve global health, that also keeps us on our toes to try to understand what's going on in the regional, global impact of the US as having in global health elsewhere. So I'll stop there, Olo. And over to you.
Thanks, Oscar. Over to you, Sonia.
And we're just talking about how the students are involved, or?
Yes, how your center has engaged students in the past, and what has been the most rewarding part of the engagement?
Oh, so much. So I am the one who primarily works with both our LLM research assistants, as well as any JD students who are interested in a focus on health policy. Uh, I also work with students from our joint degree program, our MPH program with Hopkins, who have to do their experiential learning. So I have a personal interest in mentoring and developing professional development for people who are looking to enter this field. And some of the ways that students work with us is, again, working collaboratively with doing some of our research projects. I also try to encourage students to communicate to me what focus areas they're interested on, and provide a forum for them to explore some issues in that area. I've had students who are both JDs and LLMs to co-author issue briefs and policy brief papers with me. In order to, so that's also an opportunity for you to have publication experience. Uh, we include our research assistants and our student assistants into our convenings, and so that'll give you opportunity for networking and meeting other people who work in the similar space. So I know I can probably say this for all of the teams, but I know because my team is only right now, there's only 4 of us, so we're a pretty small team, and so everybody who comes and work with us, you're fully integrated into the team dynamics, and we really want you to feel as though you're a part of the system to bring forward the policy and the scholarship and information that we're looking to bring forward. And so we try to create a meaningful space for our students to learn and grow and be part of the team. You're not just there just to be a student, and just we want you to be a fully integrated part of the experience.
Thank you, Sonia. I will move on to Jennifer.
Hi, I was actually an intern in the Center on Addiction and Public Policy while I was in law school. And it was one of those situations where I was working and just sort of I was like, I found my people now. And so I was very happy and excited to come back and do a legal fellowship with the center, which I'm currently in. We have had a variety of different students and research assistants working with us. People who are in law school, people who are in public health, people who are in medical school, and a few undergrads as well. And echoing what Sonia just said, that we're a smaller group. And so once you're in, you are part of the team. And I think that that's been really beautiful to help people really integrate and get involved in the work that we're doing. One thing that we like to do is have these interns or externs write a blog post about addiction and public policy from whatever their passion point is. And so we've seen some really great work done on people who've done blog posts on what addiction policy looked like in their home country. For example, in Zimbabwe, we've had people do what addiction public policy means for adolescents specifically, or we have one coming out hopefully from the about addiction and the queer community. And all of these sort of give students an opportunity to really express themselves in this space. And I would say the most rewarding part of this is an easy answer, because it's seeing people get that glimmer and that passion that I remember getting when I was just an intern, and that sort of like, I get it, and I'm passionate and excited to help advance public policy in this space. And so that's really special for me. Yeah.
Thank you, Jennifer. And then I'll move on to Agatha.
I think to start with, I was an RA and then a fellow, so I think it's a good journey to go through. And also I think you familiarize yourself with the work so much. So I think that's very helpful in general. And I think over the past 2.5 years or so, I've had I've worked with RAs and other folks, and I think interns and everyone, and I think it's been a great journey. I think most of them are like so driven, and they're so keen to learn, and it's just the enthusiasm is almost infectious. So I think one of the most rewarding experiences has been the one that I had very recently, wherein this intern came to us. His name's Talis, and he built our Age of Access work, which is basically tracking and analyzing policies on adolescents' access to HIV testing. And he came in with very little understanding. I don't think that this is something that, people come in with like, they know everything about it. Obviously, that's almost impossible. And as Oscar said, it's fire by baptism and baptism by fire. I'm sorry. And then it's just go. And he went through it, and he learned so quickly. And he built the work so strongly. And we ended up getting like, 2 oral presentations at 2 high-level conferences. And he was more than excited. And I was excited to see his excitement, to be honest. And then further on, like now he's gone on to kind of, and he's starting his internship at Office of High Commissioners, Office High, ugh, Office of the High Commissioner for Human Rights. And I think it's so great to see him go and do great things in the world. So I think that's the most rewarding part. Over to you, Olo.
Thank you,
And Olo,
Agatha.
sorry to interrupt. I don't want to jump the queue, but I forgot to mention something and reading one of the questions about JD engagement. Of course, we do engage with JDs, not just LLMs. But one key piece for us in our center are our practicum courses. So we teach each semester one practicum course. Practicum courses are like semester-long clinics that are not for litigation, like a traditional clinic. They're more like policy-driven type of courses. So students take the course for credit, like the seminar component, but there's a big component of the credits that goes to our projects and applied work. And that's another way in which students, both JDs and LMs, get to engage with our work we design projects, most times with external partners, but also O'Neill is one of the partners. And then they get to work throughout the semester in a guided way in a specific applied project supervised by those of us that teach practical courses, there are many that we offer through O'Neill. But I just forgot about that. Sorry to jump the queue. Over to you.
No worries, Oscar. Yeah, and I'll also let Isosa after Kashish talk a bit more about engaging as a JD, since she was also a JD at Georgetown. But Kashish, let me give you a chance to respond.
Yeah, thanks, Solo. Also, just to continue the thread from Oscar as well. I was a student in Oscar's practicum class. I think it gives you one of the first-hand experience of actually bridging both the theoretical as well as the practical world. And the practicum courses coupled with our experience that you get is actually the first flavor of what the actual practical world of global health law is. And I mean, at our Center for Transformational Health Law, we've engaged with all 3 categories of students, fellows, interns, and RAs, often at the same point of time, which becomes fun for sure. But one thing that we get to learn a lot from them is also their different country as well as regional experiences. And some of the skill sets that they get in terms of language and also tech. We do realize that sometimes we are of different generations, so they have better tech skills than us too. And so that helps us become way more productive, and especially when it comes to stuff like HIV Policy Lab, the COVID-19 Law Lab, some of the flagship labs that we have had at the O'Neill Institute. So yeah.
Thank you, Kashish. Isosa, same question, but also if you could add about how you engaged as a JD and what opportunities you see for engagements for JDs at Georgetown.
Okay, so I can start with how our team, the Center for Health Policy and the Law, definitely engages with RAs and fellows. And as you mentioned, Olo, I started as a fellow at the Institute right after graduating from Georgetown with my JD in 2022. And I think, so I initially was a fellow on the Center for HIV and Infectious Disease team. And I think just as Sonia mentioned, and as everyone has been kind of echoing, like you do really get the opportunity to get thrown right into the mix and get a lot of great experience under your belt. And I got to really practice some skills that like I never thought would kind of, fit into like the health law space, but you end up doing so much networking, you end up moderating panels, doing speaking engagements. I got to help with planning some of the convenings that Sonia mentioned. And I think now with the Center for Health Policy and the Law, I think being a JD student at Georgetown honestly prepared me perfectly for this team because I'm doing the same kind of legal analysis that I've always been doing as a student at Georgetown, but I get to do it now in this specific context where I can hone in and focus in on, you know, how does this random doctrine, like how is that going to affect healthcare on the ground? So it really is just using those same skills that have been built up by being a student at Georgetown. But I think being a JD and being able to start as a fellow and continue to work with O'Neill has really just been a great experience and a great way to build up my skills as an attorney.
Thank you, Isosa. And also just to add that we recently launched a JD program at O'Neill, and that's one of the initiatives that we're doing now just to get JDs more engaged with the O'Neill Institute. We're currently running a colloquium series. It holds every month on the third Wednesday of the month. We bring in health law professors from around the country actually to just speak about their experience, talk a bit about their research. We had Professor Michelle Goodwin kick us off in January and Professor Yale Cannon kick us off, actually took the February session, which was just a few days ago. And so, Gabrielle, I will drop my email for you in the chat just in case you want to be added to our listserv. I know we only currently email students who are in the Health Law Society. So if you're not, but if you're interested in participating in any way in the programs that we have for JD, and you can also reach out to any of the folks online today and just ask them about their work. And sometimes teams hire research assistants in the fall, but also off cycle for specific projects if that is of interest to you. I know Oscar already started to talk about this a bit, but I wanted to target this question to Oscar and Sonia since you both teach at Georgetown as adjuncts, and I wanted to ask if you could share a bit about your classes and what the classes are like, what the topics are like, to get some interest from these prospective students online.
Okay, I'll volunteer to go first, Oscar. So I teach the health equity and social justice course at the law school. I usually offer it in the fall semester. And the primary focus of that, it kind of came around pretty organically through me meeting and talking to fellow health law professors back in like 2020, 2021, and some medical school professors who just realized that there would be a much more meaningful opportunity for engagement and perspective in the clinical space if more clinicians had a better understanding of how to navigate and how to engage with people related to different socioeconomic and social determinants of health, and that there was kind of a dearth of information in that space in both the legal and the clinical medicine side. And so I saw it as an opportunity to create this course and what we talk about. So it's a US health policy focused course, and we talk through the historical perspective of health and health law and health policy here in the United States and how it has contributed to the disparities and other inequity factors that we see in order to know how to solve and resolve some of the issues in the present. We have to know how what was the precipitating factors that got us here, and that is the way to create much more of a meaningful and a sustained response. And so we go through kind of a historical framework of not even just health, but how things like housing, environmental policies, race, and other discriminatory policies have all been implicated in the current outlook of health policy here in the United States. And it's something that I think is it's kind of like default knowledge to some of our US-based students, but it is pretty meaningful for me sometimes when I am engaging, and I really enjoy having our global LLM students in there because many of them come from places that have a much more foundational approach to healthcare within their countries, and so they really bring some very meaningful perspective to the conversations that we're having about the U.S. Healthcare system and some of the policy. And so I really love having that dual dynamic of uh, our US trained JD students as well as our global LLM students in that course.
Thank you, Sonia, for starting. So the courses I teach, we have within our center, we have probably 4 or 5 courses we teach at the law school, but I'll just talk about the ones that I've been more engaged with. We teach a health and human rights practicum in the fall. That practicum it's very technical, legal. What are international human rights law standards? What are, like, we do a lot of case law across health topics. So this is like foundational course, has a lot of international human rights law, then health and human rights, and then we start going through specific topics. Of course, access, issues around vulnerable populations, conflict, and of course, commercial determinants, infectious diseases. So we go through different topics. So it feels a little bit like a survey course because we're touching on multiple health topics through the human rights framing. In that course, students get to work with external partners. So we build projects, a lot of projects in the Caribbean with our partners in Barbados and Jamaica, but also projects in South Africa. Last year we had one in Kenya. So we're all constantly building those projects so students can be engaged in that. So that's one course that the one that I teach in the fall. Then this might not be relevant for health law specifically, but in the spring, Silvia Serrano, who's the co-director of our center, and we teach a course called Comparing Legal Traditions, which I think is the only course taught in Spanish at the law school. So we teach a course in Spanish, and that's mainly for JD students, some LLM, but mainly JD students that want to strengthen their legal Spanish skills and understand more about comparative kind of legal systems and legal traditions. Also, we teach 2 other courses that are very connected. One is called Industry Epidemics, that focuses mainly on commercial determinants, the role that private actors have, mainly on unhealthy commodities, food, tobacco. We talked a little bit about environmental issues. So epidemics caused by private actors, right? Of course, there we connect a lot with Jennifer's sort of topic and what the pharmaceutical industry and the role they have had in the opioid epidemic or other sort of substance sort of addiction sort of issues. That's industry epidemics. And then there's a practical course that we run in the spring, which focuses on regulating the tobacco, alcohol, and food industry. And it's more regulatory approaches towards that. That's more cross-cutting. It's mainly global, but we try to bring some of the US angle into that course. And I'll take advantage of that I have the mic, and I'll try to answer one of the questions on technologies and artificial intelligence. And that's something that is very relevant for the work we do, right? How can law is always playing catch up to emerging issues? I mean, we're always behind. I mean, the legal frameworks are always trying to learn. I think we have had discussions internally about artificial intelligence, the impact that it will have in the health sector. But I will frame that even going beyond artificial intelligence is the role of technology and new technologies, emerging technologies, and the impact they have on health. Clear example of that, of course, in tobacco is easy. It's like nicotine delivery devices and new technologies in tobacco and the impact that it may have on public health. But also we have a project that focuses on privacy and neurotechnologies and the evolution of neurotechnologies and how do we regulate technologies that may have the impact to access people's sort of like memories and have like different types of like potential societal impact. So we have a project there. It's more regional. It's in the Americas that focuses on building sort of core principles to try to pre-regulate sort of some of those technologies, so we minimize the potential negative impact that they will have when they get roll up into our society. So I think those are some of the examples that I wanted to give on that. But I'll stop there, Ola, because you asked me to talk about courses and I went into a different topic. So I'll stop there.
No, thank you, Oscar. Before we fully pivot into questions, I just wanted to also ask Kashish, Agrata, and Isosa about their transition from being students to being professionals in this space. As former Georgetown students, what was the transition like, and how well did your degree prepare you for the work that you're currently doing?
I'll start. Thanks, Olo. So I did the LLM in global health governance, which in which you spend one semester at Georgetown and the other semester at the Graduate Institute, and then followed by that, I did an internship uh, at the WHO HQ office, where I worked a lot on tobacco control and e-cigarette regulation, as Oscar mentioned. And my transition happened relatively smoothly, also because we had the COVID-19 pandemic. There was insane amount of work happening at the institute, and we needed all hands board, and that's where I started working with the institute. Just before that, and after my LLM, I did a project with the WHO Southeast Asian Regional Office. It was a project on developing some laws and policies for a small country in the Asia Pacific. And a lot of the network and the contacts I had built during my LLM period, both at Georgetown as well as Graduate Institute and beyond and beyond the institutions, had, I think, and have even till date significantly impacted my work and my collaborations. So I think it's a great platform for not only your theoretical education, but to actually pivot into the working environment.
I can go next. I think, as I mentioned earlier, I think I feel like the Georgetown JD program prepared me very well. Um, I think it's been really interesting sort of touching on some of the legal doctrines that I learned as, 1L, 2L, 3L, whatever it is, and getting to see it from this unique light of how can, for example, something I'm looking at right now is like, how can non-delegation doctrine, how's that going to affect our healthcare agencies and healthcare on the ground? So things like that. I think transitioning from being a student to, a working professional at Georgetown, sometimes it feels like it was so smooth that I initially forgot I wasn't still a Georgetown student. Everything just kind of flowed really easily. And I think something that I found myself doing was like, I felt like a lot of imposter syndrome initially, because it feels like I'm still in this same place where I was a student. And now I'm like building up my expertise and like having that expertise be counted on. But I think something that I just kind of reminded myself was to really trust in your ability, and also trust in the fact that like your ability and the Georgetown education is like, that's what got you here. So just trusting in your skills and giving yourself the ability to take on more opportunities to build those skills. I think those things kind of reinforced each other.
I mean, I could not agree more with Isosa. I think it's so true. But I think for me, I think the transition in itself was like way smooth also, because you get to shadow your workplace for about 9 months. That's like a huge amount of time. So it's like over 2 semesters, you're like working with similar set of people, looking at the work, seeing what's happening across the center. And I think that in itself gives you a lot of time. And then obviously, you're marinating in like health law for 2 semesters. You do come out very enthusiastic. You do come out like, that you're ready to work. And you do come out with the idea that, you can learn, and there's nothing that's like, that you don't know in that way. So you know the work, you know the substance, and you know a lot more. So I think it's a way smoother way to transition into the workforce, in my opinion. So yeah, but absolutely true about the imposter syndrome.
Thank you all so much for sharing.
We
Oh,
all
Oscar.
feel that. Sorry, I just wanted to say that I've been at Unil for like, I don't know, 17 years, 18 years, and I still feel the same syndrome. So it doesn't go away.
Thanks, Oscar. And I also want to give people the chance, anyone else who wants to answer the question in the chat about the role of and influence of AI on health or health law in the future. If there's anybody else who wants to answer it before we move on. And also just to encourage people, If you have any other questions, please feel free to drop them in the chat. We still have a couple more minutes.
So I'll just have a brief comment and like share that one of our alums, LL.Ms, she is now working at the WHO HQ office in the team which looks at the intersection of AI and health. So we, especially at the Center for Transmission Health Law, are like pretty much engaged in what's happening, especially what's happening at the HQ a level. And the AI world, including the AI and the health world, is going really fast paced. And so, I mean, we hope to be engaging in that work in the future as well.
Yeah, and Ola, one thing that I would add, and this is not I mean, I'm not a used car salesman, but I just talk about like the LLM and how, I mean, for me, what is great about the program and when people come to Russia is how O'Neill is so connected with the actual applied health law community at all levels in all regions, and that opportunity to build your own network of your colleagues. I mean, your classmates end up being your colleagues, how you engage and you build that network. I think this is a very niche space to a certain extent. There are like some key centers and actors, and not to brag, but I think the O'Neill Institute is one of those key centers, in particular for lawyers, and that interdisciplinary approach, right? I mean, I talk more from the lawyer angle, but I know that other centers, initiatives within our institute take a more interdisciplinary approach. We have 19 lawyers and maybe one political scientist. So our team is not the representation of because we're more on the legal angle. But I think that's something that, as we have said, a lot of us have said, like, this is a type of work that you learn by doing. You can read, but it's a lot of like experience, and DLM kind of gives that opportunity to do that. I answered before about technologies, but I don't know if other people have anything to comment there. But Ola just wanted to make that comment.
Thank you, Oscar. Oh, go ahead, Sonia.
Oh, sorry. I just wanted to somewhat reiterate what Oscar said. One thing that I just, when I came into the Institute and started to get more engaged with the LL.M program, really appreciate an opportunity that, quite frankly, I wish I had as a student, is just how engaged and how involved both all of the personnel at the Institute are with the students, and how much we really try to bring the students into, as all of us have mentioned, into the work that we do, and the connections that we have sustained with many of our LL.M students. As we mentioned, several of them are on this call right now. We kind of, you join us and we never let you leave. So, or you never want to leave, which is an even better prospect. So, but I really do appreciate, and I'm glad to be a part of a program that really is invested in the long-term success and the long-term aspirations of our students, and really giving them the equipment and the experiences that that they will need to move forward and progress in this space. Like Oscar said, it's niche, but also the position that O'Neill has and Georgetown Law has, with like literally being 2 blocks away from the Capitol. You will see it every day that you come to campus. Is it's significant, and all of the other both domestic and global uh, sectors that are headed here in Washington, D.C., and the opportunities and the connections that you will be able to make through Georgetown and through the O'Neill Institute is definitely. I'm proud to be a part of it, and as a student, I wish it was something that I had the opportunity to engage with as well.
Thank you, Sonia. And just to add to what has already been stated especially about the institute, that most of the centers here, I think all of the centers are very nimble, and so there's, students sometimes come with ideas of things that they want to do, and they say, oh, I have this idea, and they eventually find a space to do it. They find, people who are partnering with them to write a paper or to write an expert column. So even if the work doesn't exist now at the intersection of health and AI, even though I'm sure there are courses at Georgetown Law that address that intersection. I think that that is something that even at the level of being a research assistant, you can speak to someone you're working with or someone at the O'Neill Institute and just share, this is an interest for me. How can I bring it to life? And it's something that, would definitely, there would be space for that. So thank you for your question. And I
Although just to add there one small comment that
Mhm.
also, I mean, coming to Georgetown Law, you get access to other centers and institutes, right? And our mandate is specifically on health and law. That's like our thematic area. But even in our same building, we have a center that focuses on privacy and technology, and they are like one, and we partner with them on very specific projects. And we have other centers focused on like in voting rights, climate change. I mean, there's definitely like thematic expertise in other applied think tankish centers within the law school. So there's that way in which we also engage with the depth of expertise that other colleagues have on campus as well. So that's another way to connect it.
Thank you, Oscar. Yes, so just to let you know that there's space for whatever ideas or interests that you're bringing into the LLM program, or if you're a JD, into your JD. As we start to wrap up, I just wanted to ask a quick question. I know that most people online will know about what's happening in global health now, especially with the US political climate. And I just wanted to find out, with major shifts that are happening now in global health, including, the US withdrawal from the WHO, changes to the USAID, and evolving political dynamics both within the US and beyond. What should students be paying attention to in the field? Where do you see global health law heading? And how do you see your work evolving basically with these changes? And I will not be calling on anybody to start because I've been called out. So I'm going to see whoever wants to jump in first.
I'll start first, and then I will give the floor to the people who work more in the global space. But what I am experiencing, both in conversation with my JD and domestically trained students and global LLMs, and just in the work that I do domestically, would say just the critical importance of combating misinformation and disinformation, and also really keeping a focus on the need for adherence and policies and practices to be based on proven evidence-based foundations, is, at least in here in the domestic space, is of critical importance, and what I am finding myself having to really both advance in my own work and communicate with my students as they are looking at or asking me questions about some of the policy concerns that they have, dealing with right now in real time, is just really keeping a focus on the need to both, and that for us here domestically also is just conversive, just within our expertise as lawyers and lawyers to be, and people who work in this space, just within our own social networks, just to remind people that things need to remain in the evidence base to try to dispel some of the rhetoric that is causing some undue influence within society.
Olo, I'll just give one thought on it. I do see this as an opportunity for a lot more regional work happening across the world, and a lot more different emerging economies, as well as units and sectors actually coming up, and we will see a lot more happening in, for example, ASEAN, the South Africa bloc, the entire African Union, the EU, China, India. And I think the geopolitics in global health governance is going to see a bit of a shift in the next couple of months. And I also say that in context of the ongoing WHO pandemic treaty negotiations. You never know, because of US moving out, we might end up actually having the pandemic treaty. But then there are implications of what happens with the pandemic treaty's implementation without the US being on board. So it's a very challenging time, but it's a very interesting time at the same point here.
I I think Kashish should have gone after me or Sonia, because I'm not gonna bring the more optimistic note. I think some of the things we're seeing globally are outrageous, and I'm going to be honest. What the way foreign development assistance for health funding was cut from one day to the next, the impact that that is having on access to treatment all over the world. But I'm talking about like basic treatment. There's like food programs that have been cut up in Nigeria, and we're working with some of the partners because they were receiving funding from USAID. So I think this also calls for, Ms. Kashish, is a change of rethinking global health governance and what is the structure, and hopefully new actors will emerge to fill that gap. I think right now we're still assessing what is going to be the overall impact, because what is clear is how much of that investment was coming from the US government and the gaps that that is leaving all over the world. That's more on the funding piece. I think we're working with partners, with governments, I mean, how they can diversify the funding streams. I mean, private actors are coming in to try to fill in some gaps. But there's, I think, complex scenarios on the funding piece and on the more political side. I think my concern is whether that will percolate also into the governance mechanism and into the legal structures, right? I mean, that challenging of the international legal frameworks, that we're at least trying to build a basic floor of how countries needed to deal with like health related sort of threats, issues. I'm not going to talk about pandemics because Kashish already mentioned that, but the Framework Convention on Tobacco Control is turning 20 this year. And now there's kind of that kind of political intention also to kind of channel corporate interest and try to minimize and water down the impact of this treaty, which have been positive for public health across the board. So I think it's going to be some chaotic set of months, if not years, and maybe things will settle down the line, and we'll see what is the new structure and new sort of like power dynamics. I'm hopeful that, I know, South Africa, Brazil, they're countries that hopefully will step in as they have done in the past, but I think right now it's still very hard to see how all of this will play out. But
Thank you all so much. And thank you to everyone for joining. I want to say a huge thank you to our panelists. I know we're a bit over time, but thank you so much for joining and being willing to share a bit more about your work than our students or prospective students and admitted students previously knew. I hope this has been helpful to just help give a brief background about our work, give you some ideas about what you could do with a degree in this space, and just expand your knowledge of the field and give you an introduction into what you would be seeing when you come here to Georgetown. These are people that you will definitely meet in person when you get to do the LL.M. So hopefully they have been fascinating enough for you over Zoom that you are looking forward to meeting them in the fall. But I want to thank you all for joining. If you have any questions, please feel free to reach out via email. And you can also find everybody here on LinkedIn. Their emails are available on our website. And you can also reach out to me to ask for their emails if you would like to hear more information about the work they are doing, or just find ways to partner, or even just thinking about networking ahead of coming into the LL.M. So thank you so much for joining again. We'll have a recording sent out in a couple of days, sometime next week. But I hope you have a great weekend and rest of your Friday if this is morning for you. Thank you.